Have you ever walked out of your doctor's office and suddenly remembered 3 questions you meant to ask? Or maybe you felt rushed, nodded along to terms you didn't fully understand, and left with more worries than answers. If that's happened to you, you're not alone. In fact, most seniors feel this way at some point. But here's the thing. Your health is too important to leave to chance. Today we're talking about how to talk to your doctor after 60, because those conversations can shape your health, your independence, and even your peace of mind. I'll share 5 essential questions you must ask at your next appointment. These aren't just random tips. They're tools to help you take charge of your care. Let's start with the first question that could change everything about how you're treated. Meet Margaret. Margaret's 68, loves her morning walks, and has been on the same blood pressure medication for a decade. At her last checkup, her doctor asked, "Still taking the blue pill?" She said yes, and that was it. But a month later, she started feeling dizzy. Turns out her medication dosage was too high for her current weight, something her doctor could have adjusted if she'd asked one simple question. Is this medication still right for me? You see, our bodies change as we age. A pill that worked at 60 might not be ideal at 70, but doctors aren't mind readers. They rely on you to bring up concerns. So, here's what to do. Bring a list of all your medications, even supplements, to every appointment. Ask, is this dose still correct? Could this interact with my other pills? Are there newer options with fewer side effects? Margaret did this, and her doctor switched her to a lower dose. No more dizziness, but let's not stop there. The second question is just as critical. What screenings or tests do I need now? Take George, a 72-year-old retired teacher. His doctor recommended a colonoscopy for years, but George kept postponing it. Finally, his daughter insisted he ask, "Is this still necessary?" Turns out, yes. And that test found precancerous polyps early. George's takeaway? Asking that question gave me 20 more years with my grandkids. So, at your next visit, ask, are there new guidelines for my age? What's the benefit versus risk of this test? If this test is normal, when should I repeat it? This isn't about doubting your doctor, it's about partnering with them. Now let's talk about the third question, one that's often overlooked. What's causing this symptom, and what else could it be? Here's why this matters. As we age, symptoms like fatigue or joint pain can be blamed on just getting older, but they might signal something treatable. My friend Linda, 65, complained about constant tiredness for months. Her doctor said it was normal for her age, but Linda pushed back. Could it be my thyroid or a vitamin deficiency? Turns out she had severe B12 deficiency. A simple supplement changed her life. Your turn. If your doctor says it's just aging, ask, what else could this be? Are there tests to rule out other causes? If it is aging, how can we manage it better? And here's the fourth question. What happens if I do nothing? Many treatments come with side effects, and sometimes watchful waiting is the best path. For example, my neighbor Sam, 70, was prescribed a statin for slightly high cholesterol. He asked, what if I delay medication and focus on diet first? His doctor agreed to a 3-month trial. Sam cut back on sugar, walked daily, and his levels improved enough to avoid pills. This question empowers you to weigh risks and make informed choices. Ask, are there alternatives to medication? Can I try lifestyle changes first? Finally, the fifth question, the one thing you should never leave the office without asking, what's the next step, and when do I follow up? Doctors are busy, but this ensures you're on the same page. For example, if they adjust your blood pressure medication, ask, when should I check my BP at home? How soon will we review this? What symptoms mean I should call you immediately? Take notes or ask for a printed summary. My Aunt Ruth, 75, brings her grandson to appointments to scribble down details. No shame in that. Now let's tie this all together. Your health isn't a one-way street, it's a conversation. Bring that list of questions, speak up, and remember, you're not just a patient. You're the CEO of your well-being. If you're feeling overwhelmed, start small. Pick one question from today's video and practice it at your next visit. Then come back here and tell me how it went in the comments. I read every one. And if you found this helpful, hit like and subscribe. Together, let's make sure your voice is heard, because your health deserves nothing less.